So, Riley, conspiracy theories have long circulated about the origins of the coronavirus. What have we learned from the World Health Organization's investigation?
Yeah, as you mentioned, we now know that the coronavirus most likely did jump from humans through an animal host or through frozen wildlife products. And this ends, that conspiracy that for quite some time people have been circulating about a potential laboratory leak. According to the World Health Organization, no further research is needed to look into the theory about a leak that the virus might have escaped from the Wuhan Institute of Virology, which is home to a maximum biocontainment laboratory that studies bat-borne coronaviruses. U.S. President Donald Trump actually fueled the flames of this conspiracy, among others. And the WHO underscored that the virus could have been introduced at a wet market in Wuhan, which many of the first COVID patients were linked to, either by a person who was infected or by a product that was sold there. The team also examined thousands of patient samples from Wuhan prior to the emergence of sick people in 2019. And there was no evidence of significant outbreaks in the country before December 2019, WHO officials have said. So hopefully this puts that laboratory theory to rest, and we can move on and talk about confidence in the vaccines themselves.
So what do we know about confidence in the vaccines? Because we have seen so much misinformation about not only the coronavirus, but also about these new vaccines and perhaps their side effects. What do we know at this point about how people feel?
Yeah, it's a great question. And I'll tell you, I've been covering the pandemic since the get-go. And my very first story that ever mentioned COVID was about this subject of misinformation. So we haven't come very far. Now, much of that misinformation is related to the vaccine, and we need to rewrite the record in the U.S. and beyond, given vaccine hesitancy remains a grave concern, and it could hamper mass immunization campaigns and our ability to achieve herd immunity. Today, we actually learned that only about half of U.S. adults surveyed late last year said that they were certain or very likely to get a COVID-19 vaccine, according to the Centers for Disease Control and Prevention. This study was conducted back in December, which, if you remember, was when those first two COVID vaccines were authorized in the U.S. And just under 20% of adults in December said that they were somewhat likely to get vaccinated, and over 30% said that they were not likely. Actually, about half of essential workers and adults with other medical conditions said they intended to be vaccinated, even though both groups are at higher risk of contracting severe COVID-19.